So I am Salome Maswime. I'm the professor and head of global surgery at the University of Cape Town. I basically work for the Department of Surgery, where I head up a new division that we started about 5 years ago. But I'm an obstetrician and gynaecologist by training. An obstetrician is a doctor that looks after pregnant women throughout pregnancy and after they've had childbirth. And a gynecologist is a doctor that looks after women in general, looking at the reproductive organs and diseases that affect the organs within the pelvis. And so an obstetrician and gynecologist is basically a women's doctor. After I became a doctor, then I had an opportunity to work in a labor ward during my community service. And at that point, that's where I experienced both the joys of working in a labor ward, delivering babies, the excitement you see on the mothers when new babies are born, but also realized that women also die due to complications related to childbirth, and babies, unborn babies, can also die prematurely before they are even born. That gave me sort of a deep sense of purpose, and I guess that's one of the reasons why I specialized, because I felt that if I learned more, I'd be able to improve women's outcomes. The problems were much bigger than what I expected. These were problems across the continent, across the world, where women who required cesarean sections were not always able to get them, or if women had cesarean sections and had complications, many of them would die because they were not able to access the right quality of care. And so that led to me getting involved in a discipline called global health and eventually getting into global surgery. So what's been really exciting and unique about global surgery is that it's a multidisciplinary field. It's not just obstetricians or surgeons working alone, but we work with the entire clinical team. So from nurses, rehabilitation specialists, physiotherapists, and all the people that work within the hospital. But we also work outside of the hospital as well with politicians and decision makers who are creating policies for healthcare and surgical care. We work with communities as well about them accessing care. So it's a very multidisciplinary field, which has required that we also work with other disciplines, such as the engineers who are developing devices and other things related to surgery. Over 1 billion people in Africa, and that's more than 90% of the population in Africa, is not able to have access to safe and timely surgery. So that means they either will not be able to get it based on where they are, or if they get it, they may not be able to have a good outcome, and they may have complications, which they may end up losing their lives because of that. And so access to safe and timely surgical care is the real challenge in Africa, and that has to do with how health systems are organized, how near is the hospital. Does the hospital have specialists? If you have a complication, is there an ICU bed for you? Is there enough oxygen ventilators for someone who's got complications? So I was born in KZN, but originally I'm from Limpopo. That's where my parents come from. And so most of my upbringing was in Limpopo. I did my primary school and my high school there. When I was 11 years old, I was involved in a car accident. As a result, I fractured my humerus and I had injuries, internal injuries to my abdomen, which resulted in the doctors having to remove my kidney. When you have a near-death experience and you realize that there's a reason why you're still alive, it kind of changes the way you think about life. You know, there was a possibility for me to become a doctor and for me to save other lives and for me to contribute or to be there for people that find themselves in similar situations. For girls particularly, especially girls who are ambitious and who want to change the world and have big dreams, so often you're told not to, like take a simple job, don't do complicated things, think about your children one day. Before girls even have children, you're already told don't take a job that will affect the type of mother or wife that you're going to be one day. And I think as a young girl, You need to be told to follow your dreams, to follow your passions and ambitions, to be the best that you can be, that nothing is too big or too difficult for you. And that's the encouragement and advice that I would give to younger girls.